question is to the Minister of Health, does he stand by all his statements on health services?
The Honourable Tony Ryall.
Mr Speaker, yes, including the fact that the Labour government left DHBs delivering over $150 million of unfunded health services, including the Mid-Central DHB providing around $10 million in services that her government did not fund.
The Honourable Ruth Dyson.
What explanation can he offer to the Greater Auckland Integrated Health Network, who have now quit the planned integrated family health centres, saying that despite them being central to the national government's restructuring of primary health care, they've totally given up on creating them because his government is offering no money to help set them up?
The Honourable Tony Ryall.
The member is well aware that the government believes that integrated family health centres will in fact be developed by the private sector.
The Honourable Ruth Dyson.
How do his statements tally with the Wanganui Chronicle report that half of the people in Wanganui waiting to have ultrasound scans have now been told to look elsewhere as the Health Board tries to clear a log-jammed waiting list?
The Honourable Tony Ryall.
Mr Speaker, there is an issue in Wanganui resulting from their difficulty in recruiting an additional sonographer. Some weeks ago I rang both the Chair and the CEO, and I was advised that of the referrals, all urgent and maternity cases are being dealt with. Those that fall outside the thresholds are being reviewed to see if there is an alternative diagnostic approach or if they still need such an assessment. This is not unusual and happened under the previous government.
The Honourable Darren Hughes.
Supplementary to the Minister of Health. Why will Horowhenua and Otaki residents face a cut in their access to assessment, treatment and rehabilitation beds at the Horowhenua Health Centre than what they had before the change of government?
The Honourable Tony Ryall.
Mr Speaker, only days ago members opposite were telling the people in that community that all the beds would be closed. And in fact the proposal from the DHB is to maintain the same number of beds providing service for patients in Horowhenua. Mid-Central's challenges do not stem from any cuts to funding by the new government. We have given the DHB an increase of $26 million this year, or 7%, one of the largest increases in the country, and there will be a significant increase again in the budget. Its challenge arises from Labour's legacy of mismanagement, leaving up to $10 million of unfunded services that it is working hard to fill.
Dr Paul Hutchison.
Minister of Health, how is the government filling the gap of over $150 million of unfunded services it inherited from the previous government?
The Honourable Tony Ryall.
Mr Speaker, the government is working hard with district health boards to deal with the legacy that we inherited of $150 million of unfunded services. This year, the government invested an extra $536 million in district health boards up and down the country, and funding next year will put health on a record unprecedented by the failed crowd opposite.
Ian Lees-Galloway.
Thank you, Mr Speaker. How is allowing Mid-Central District Health Board to cut overnight district nursing services better?
I apologise to the member, but could I just ask his front bench colleagues, more than one of them, please to show some courtesy to their own colleague, Ian Lees-Galloway.
Thank you, Mr Speaker. To the Minister, how is allowing Mid-Central District Health Board to cut overnight district nursing services better for people who are dying and wish to pass away with dignity in their own home?
Honourable Tony Ryall.
Mr Speaker, in relation to the overnight district nursing service, I have spoken to the Chair and senior management at Mid-Central, and they assure me that alternative treatment plans will be put in place and people will be looked after. The service will also continue to work with the local Arahanui Hospice, which received an increase of around $300,000 extra this financial year. Mid-Central's challenges do not stem from any reduction in funding by the new government. We've given the DHB an extra $26 million this year.
The Honourable Ruth Dyson.
Does Bill English's comment to Grey Power that he knew their pain about home support cuts because his wife forced him to clean their bathroom reflect his view of cuts to home support for elderly as well?
Mr Speaker, of course there are going to be difficult cases throughout this process, but I say to that member, if there are any cases that she would like me to look at as a result of these changes, please forward them. I am advised to date that we have not received any advice from Mrs Dyson on any of the cases that she's raised in Parliament on this issue.
I beg your pardon. Point of order, the Honourable Darren Hughes.
Mr Speaker, I raise a point of order to seek the leave of the House to table a document from the Mid-Central District Health Board which outlines a proposal to cut 24 assessment, treatment and rehabilitation beds in response to a lack of funding from the National Government.
Order. Leave is sought to table that document. Is there any objection? There is no objection. Point of order, the Honourable Trevor Mallard.
Mr Speaker, I seek leave to table a document asking for further financial support on the behalf of Bill English for cleaning at his house.
Order. Leave is sought to table this document. Is there any objection? There is objection. Question number 4, John Hayes.